And good morning. It is Tuesday, June 9, 2026. We are streaming live spine surgery from Deuk Spine Institute. Our patient travels from Maryland. Now, he's had pain in his neck for 2 years. He has herniated discs, 3 of them to be exact. One of them is really bad. It's very big and it's causing most of the symptoms. The other 2, much less so. His primary symptom is right arm weakness, numbness, tingling. Per Florida statute, he has an emergency medical condition with loss of function of the right arm. Our approach will be from the left side, the opposite of the worst arm, and we're going to be performing laser spine surgery today. You're going to watch the future of spine surgery right here at Deuk Spine Institute today. We've been doing the same surgery for 20 years. It is FDA approved, peer reviewed, and published over 10 times in the medical literature. And yet, we're the only center in the world doing it. Why is that? Unfortunately, there is a lot of influence in medicine by pharmaceutical companies and medical device companies. They are promoting the use of their devices, which make them billions and billions of dollars a year in profit. Our procedure uses no devices. It's a natural way of repairing a disc using an endoscopic approach through a 4mm incision. So there will be no metal, there will be no disc replacement or fusion. Shot? We're going for the C5-6. 2, 3, 4, 5, 6. Show us, Jordan. C5-6, please. He has a beautiful neck, by the way. Shot? All right, there it is. 2, 3, 4. Start with number 2. 2, 3, 4, 5, 6. Everyone agree? 5, 6. All right, let's go ahead and get an AP view. I want to see where we are. I'm going to use the X-ray machine, which you guys can see, using a front, back, side views. There are 2 different views to make sure we're lined up perfectly on the spine. Now I want you to take a moment and look at that X-ray. Look at the endotracheal tube and the esophageal temperature probe. They are displaced to the side by my fingers. That is part of the surgery. I have to push everything over. Shot? Perfect. So we're right over C5-6. I'm going in. Shot. We're right in front of the spine. Let's get another AP. Make sure we're dead center. You want to enter the front of the disc dead center between the longest colli muscles. Preferably, we're perfect center. Show that. Go ahead and look at those spinous processes right there. Those are the spinous processes. That means we're dead center. And that's where we want to be. Shot? All right, I'm entering the disc at 5-6 with my needle. I'm going to puncture through. And now I'm in sort of the center of this 5-6 disc. You guys see that? Shot?
Yes, we do.
We're right in the middle with the needle. Okay, this is the first part of the surgery. It's called gaining access. We're getting access to the herniated disc. Herniated discs are so common. They're the #1 reason people have neck pain. But there are 30 very specific causes of neck pain. And Deuk Spine Institute, we're the first in the world to discover those 30 causes and develop treatments specific for each one. Let's show the audience the 30 causes of chronic neck pain while we get into this disc to fix it. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. You can see the 30 causes of neck pain. The number one cause is a herniated disc. There are many names: slip disc, bulging disc, herniated disc, protruded disc, extruded disc, ruptured disc. All mean the same thing, a disc herniation. Show us Jordan on the x-ray. Can you see the x-ray, Anthony? Go ahead and take the x-ray feed. You guys see the arrow? It's pointing to a huge herniation at C5-6. That's what we're going to remove today. Did you see that, Anthony?
Yes, we do.
Shot. Now I'm advancing the dilator through the disc to the very back. Again, this is number 5-6. Any questions from our audience?
Yes, we have one question from Lanu on YouTube.
Hi, Lanu. Welcome. I think Lanu's in Indonesia.
I believe so. This patient only has herniation in C5-C6, but not other area?
No, this patient has 3 herniations. Number 5-6 is the worst of the 3. We're only fixing 1 herniation per the patient's request. I recommended fixing 2, at least 2 of the 3 herniations, but the patient wanted to do 1, and I respect the patient's choice. Remember, doctors, we're not, dictators. We are diagnosticians, first and foremost, and we are educators. We tell our patients what's wrong, teach them about how to fix it, and then we're technicians, okay? So I only do what the patient wants me to do. This patient only wanted to fix 1 disc. So that's what we're doing. All right, Sean, I think that's good. I'm all the way at the back of the disc. We're going to take everything out. I want you to know we have lost 1 drop of blood. 1 drop right there. You guys see that? Pull away, Jordan. 1 drop of blood. So if you go and have a fusion done or an artificial disc, the surgeon's going to cut your whole neck open. They can damage your swallowing tube and your breathing tube and give you nerve damage, cutting the recurrent laryngeal nerve so you can't swallow or talk properly. Very common problems. All that trauma internally with that surgery, and then they fuse your spine or disrupt the biomechanics. With this surgery, we're doing none of that. No bleeding, no difficulty swallowing, no hoarseness, no nerve damage, nothing. Just in and out like a ninja. Any questions?
No questions.
By the way, this is the endoscope. There's a camera and a scope and a light source, a laser fiber, and irrigation. We're going to go down this tube. This is a 4 millimeter wide tube. So the whole surgery is done through a tiny little tube. That's all we need. And there it is. There's your herniation right there. All right, do I have the pedal? Great job, Jordan. Sam, whoever placed the pedal. There's 1 piece of herniation. You see it? Here it comes out of the tube. Say goodbye. Now the typical herniation is around 30 pieces of herniation. Here's another one. Okay? So most patients that come to us have about 30 pieces of herniation. That means they had 30 episodes of herniation. So people think a herniation is just one event. It's not. Oh, I got a herniated disc. No, you had many herniations that make up your herniated disc that's seen on MRI. So it's multiple episodes of injury and squeezing out pieces of herniation. Let's show the audience how a herniated disc can be so painful, causing neck pain, headaches, and arm symptoms.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. From our animation, you can see how a herniated disc, which is a result of trauma, discs are basically normally no pain, totally asymptomatic. They're just a cushion between your vertebrae or bones in your neck, specifically the vertebral body. And what happens is during our lifetime, we have some type of trauma to our neck. You end up ripping the ligament that holds these bones together. And that's called an annular tear because that ligament has a special name called the annulus fibrosus. Once that ligament is ripped, then at the same time from the trauma where you rip that annulus and cause an annular tear, you also crush the adjacent nucleus pulposus, which then fragments the nucleus into little pieces. And those little pieces start to work their way out through the tear in the back of the disc. That's what we're looking at right now. These are fragments that I'm using the laser to remove, fragments of herniation, and you can see the tear left to right. There's a huge tear. It's allowed all these fragments to escape through the back of the disc. Well, what lives behind your disc in your neck? Your nerves do. Your nerves and your spinal cord. And that's what's going on here. This poor patient injured his disc, and now his nerves and spinal cord are being crushed. And I'm using this laser to remove the herniation. Look at that. Literally 1/10 of a millimeter at a time. 1/10 of a millimeter at a time. That's the kind of precision we get with the laser. There is no other instrument in medicine that is as precise as a laser, a medical laser, that's used endoscopically. The key is endoscopic. You cannot do this kind of precise work without the endoscope. So we have an endoscope, that's the tube and the camera system that we're using to see this herniation right where it's putting pressure on this patient's spinal cord and nerves. This is not surgery for the faint of heart. This is not surgery for pain management doctors to do. This is surgery for a neurosurgeon normally to do when you're operating this close to the nerves. You want someone who has experience doing it. Any questions from our audience?
Yes, we have a question from Johns on YouTube.
Johns?
Yeah, Johns.
Hi, Johns. There's a piece of herniation right there coming out. You guys see that? So remember, I told you this thing has about probably 25 to 30 pieces of herniation. You know? Yes, Johns.
I had a ACDF surgery in three spots this past Thursday, and
Yes.
it still hurts so bad to swallow.
Yeah.
Is that normal?
Unfortunately, ACDF and difficulty swallowing is very common. Yes, it is normal. That's why we don't do ACDF anymore, because people have trouble swallowing. Let's pray that it goes away quickly for you. If you're having severe trouble swallowing, what you can do is talk to your surgeon and they may want to readmit you to the hospital and put you on some steroids, some IV Decadron. That will help your swallowing a lot. But on the other hand, your surgeon may not want to do that. So just talk to the surgeon and see if they could, give you some steroids to reduce the swelling that's going on in your throat. Yeah. Worst case, they can give you an over-the-counter Medrol pack. But again, you got to talk to your surgeon, because that's what I would do. It doesn't mean that's what your surgeon will do. You've got to find out from the surgeon, okay? All right, we got some bone spurs back here as well that we're removing with the laser. People ask me, Dr. Deuk, can that laser cut bone spurs out? And the answer is yes. This laser is so powerful, it could cut through steel. No problem. It does cut through steel. If you look at the metal tube down there, you'll see little areas where the laser hit the metal and melted it. Little blast marks. All right, let's show the audience, Anthony, how we use this laser and scope to go in and repair this disc for the patient using the Deuk laser disc repair treatment.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right. Welcome back, folks. You can see we're looking down the crack here of where the herniation was, and there's still a little bit left that I need to remove here, but we've gotten rid of quite a bit. Now, some people ask me, Dr. Deuk, are you going to get rid of all the herniation? The answer is no. There is no surgery on earth that will get rid of all the herniation. It's not possible. Okay? Surgery cannot do that. And the reason is we are limited in surgery by the patient's anatomy. All right, I've done pretty good. I'm going to go a little further to the right. This is, remember, the right side is where his nerve is being pinched the worst. So I got to work my way over to the right side. And that's what I'm doing. Any questions from our audience?
We have a question
5
from
minutes.
We have a question from Lanu on YouTube.
Sure. Hi, Lanu.
Some of my associates suspect there's a connection between herniated disc and migraine headaches. What's your view on this?
I agree, Lanu. We call it a cervicogenic headache. It's a headache that people get that comes from a herniated disc in their neck. And what happens is the herniated disc causes a lot of muscle spasms, which tighten up your muscle. And it also causes inflammation, which goes out onto the dura. Watch that fiber. The dura is the covering of your brain. So it travels from your spinal cord and goes up to your brain. It covers your brain and spinal cord, spelled D-U-R-A. And the dura is innervated with pain fibers, okay? What that means is the dura hurts. When it's irritated, it hurts. And that's exactly what's happening. All right, let's see. This is a very, watch that, this is a very muscular patient. So we're trying to get further off to the side here to get more of the herniation. But his shoulders and chest are sort of blocking the way. Oh. All right. Any other questions?
No questions.
And we did show the audience, let's flip, how the laser procedure is done, correct? We showed that animation?
Yes, we have.
Good. Here's another piece of herniation. Our cure rate with this procedure for getting rid of pain is 99%. That's the average. Watch the fiber. So there's no other treatment in the world that cures 99% of neck pain. This is it. All right, I'm just taking another look here at what's going on. Just seeing if there's more herniation that I can get rid of. Any questions?
No questions.
All right. Then let's show the audience the Deuk laser disc repair versus other treatments that are invasive, so they understand the benefits of this treatment versus other treatment that are available to them. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I'm here to talk to you today about neck pain and its common treatments. Neck pain has different causes. The most common cause of neck pain is a herniated disc. Herniated discs account for about 85% of chronic neck pain. The second most common cause of neck pain that's chronic is the facet joints. There are facet joints on both sides of the spine, left and right. There is one facet joint for every disc. Facet joint pain requires a different kind of treatment targeted at the facet joint itself. For disc pain, which accounts for 85% of neck pain, the best treatment in the world is the Deuk laser disc repair. It is the most advanced treatment that is the safest and has the highest chance of successfully eliminating symptoms. Let's talk for a moment about what's important for patients who are considering treatment for neck pain coming from an injured or damaged disc in their spine. The most important thing for patients, number one, is getting rid of their symptoms. The type of symptoms that disc herniations or disc injuries can cause include neck pain, headaches, and symptoms down the arm, such as weakness, numbness, tingling, or even pain shooting from the neck down into the arm. The symptoms of neck pain include disc herniations, which are the most common cause, and patients want those symptoms gone. That is their number one priority and goal. The second most important goal for most patients is to avoid a complication from the treatment. Medical treatments do have complications, and the more invasive the treatment, the more likely a complication will occur. Complications from surgery, for example, can include blood clots, pneumonia, heart attack, infection, failure of the spine to heal properly after surgery. There can be implant migration or implant failure, adjacent segment disease, and vascular complications such as injury to the blood vessels or nerves in the neck, including the trachea and esophagus. Nobody wants a complication from spine surgery on their neck, so less invasive is typically going to be a better option to avoid those complications. The third thing patients really want when they're looking at treatment options for curing their neck pain is they want a quick recovery. People want to get back to a normal life as quickly as possible. They want to go back to their activities, they want to be active, they want to play sports, and they want to go back to work. And finally, the next thing to consider is long-term results. For example, if you have a treatment today and it works, how long will that treatment last, and will it create additional problems down the road for you? Treatments like spinal fusion that are invasive typically result in the need for additional treatments such as pain management, physical therapy, and possibly additional surgery. We're going to look at each of these individually and go through each of these options individually. So we're going to start with more invasive treatments that are typically recommended for patients with herniated discs or degenerated discs in their neck. The most common treatment recommended around the world is anterior cervical discectomy and fusion. That is a surgical treatment where the entire disc is removed surgically through a large incision that is very risky. There's bleeding associated and risk of injury to surrounding structures such as the esophagus, trachea, and blood vessels in your neck. Complications are very common with this type of surgery. The complication rate is accepted at 48%, which is a very high number. So if you're considering ACDF or anterior cervical decompression and fusion, you are looking at a very high complication rate. The success rate of this surgery at eliminating neck pain is very low. It's somewhere on the order of 25%. That is the generally accepted success rate at eliminating neck pain. An additional treatment that you can consider is artificial discs. Artificial discs are very similar to ACDF. The difference is instead of fusing two bones together with a metal plate and a cage, we're actually putting in a mobile disc made out of metal and plastic that moves. The problem with the movement is that these discs do pop out of the disc space. Over time, they can fail. They can cause collapse of the vertebral body above and below through fracturing, especially in patients with weak bones, such as osteopenia or osteoporosis. Those types of patients are at high risk for complications from both ACDF and artificial discs. Another complication from artificial discs is that you can develop facet joint pain and adjacent segment disease, very common with artificial discs and fusion, and they typically have the same rate of adjacent segment disease. There's also a long recovery associated with both ACDF and artificial discs. Recovery can take months to years, if recovery even happens at all. There's tremendous scarring in the wound associated with ACDF and artificial discs. Lots of scar tissue, lots of pain, and lots of problems after these surgeries that are invasive. Alternative treatment would be to go in the back of the neck and do a cervical laminectomy and fusion. Again, large incision, high chance of complications, very long recovery, taking years to recover. All three of these types of surgeries, ACDF, artificial discs, and posterior cervical laminectomy and fusion, require the use of postoperative narcotic painkillers. Narcotic painkillers are opioids. They are dangerous. People get addicted to them, they can be abused, and people can overdose. It's easy to overdose on narcotics because you want to keep taking them to treat the severe pain you're going to have after these invasive type surgeries. The severe pain can last weeks or even months, and the addiction can happen very quickly. Let's move into less invasive treatments such as epidural steroid injections. This is a treatment commonly recommended by pain management doctors. They stick a needle into your spine and inject the steroid medicine to reduce inflammation. While this treatment can be effective at temporarily giving you relief for a few days or even a few weeks, the pain always comes back from a herniated disc because the source of pain is never being treated. The annular tear and inflammation within the annular tear is not treated by an epidural steroid injection. The steroid goes throughout your body and causes systemic side effects such as high blood pressure, elevated blood sugar. In patients with diabetes, this could put your sugar up into the 300s and 400s, which is very dangerous for patients. So steroids should be avoided as much as possible. Next, let's turn to spinal cord stimulators. The problem with spinal cord stimulators is they are highly invasive and they are frequently put into patients by untrained doctors who are not surgeons. These doctors are typically pain management specialists, and they're putting these stimulators in patients not because they can cure your pain, but because it's another treatment that they have up their sleeves. These treatments with stimulators pay these doctors obscene amounts of money. The profit for the doctor can be in the tens of thousands of dollars. Avoid spinal cord stimulators. They do not work, they're dangerous, they put you at tremendous risk, and in the end, basically you're taking this device, sticking it on top of your spinal cord and putting a pacemaker under your skin that you're gonna have to live with for the rest of your life. They cause scar tissue and they frequently migrate and get out of position. Next, we're going to talk about physical therapy. While physical therapy has many benefits, such as keeping you toned and fit while you're struggling through the pain and trying to stay mobile, but physical therapy will never, ever cure pain in the neck from a herniated disc. It will just try to keep you active and from getting more and more sedentary and developing deconditioning of your muscles because you're sitting around because you have neck pain all the time. Finally, let's talk about the Deuk laser disc repair. The Deuk laser disc repair is the solution for neck pain. If you have a herniated, bulging disc, extruded, ruptured disc, protruded disc, or degenerated disc, The Deuk laser disc repair works by minimally invasive treatment, going to the back of the disc where the problem is coming from. This is the tear in the back of the disc that has inflammation, and using a laser that is extremely precise. The laser fiber itself is 0.5 millimeter or half a millimeter wide, and the endoscope allows me to see 1/20th of a millimeter. I can directly see the nerves and spinal cord. It is an extremely safe treatment. As far as results go, the Deuk laser disc repair has the highest success rate of all the treatments we've discussed so far. We have a 99% cure rate of neck pain coming from herniated discs, and the Deuk laser disc repair has 0 surgical complications to date. Our patients have an immediate recovery. In 1 hour, they're leaving our facility and they're going back to their hotel room. They usually drive themselves in the next morning for a quick checkup, and then it's back to a normal life. Well, I've enjoyed talking to you, and thanks for taking the time to listen to our video. I'm Dr. Deukmedjian. We'll also find this on our podcast, the Deuk Spine Institute podcast. Thank you.